So that's it. It's the final head to toe video. So let's just get right into it. So I'll knock on the door and I'll let the client know that I'll say my name's Nurse Amanda, and I'll tell them I'll be doing a head to toe exam on the client. I will wash my hands, put on a clean pair of gloves. I'll have the client confirm their name and date of birth, and then I'll check their bracelet. I'll provide privacy for the client and let them know that this exam will be a little bit of inspecting, listening, touching. And then once that is done, we'll move on to the client's appearance and mental status. So basically what that consists of is their level of consciousness, making sure that they're alert. I'll be asking them to confirm today's date and time. I'll assess their quality of appropriateness of speech, and then I'll just make sure that their posture and hygiene is appropriate with like their age or what they're in the hospital or wherever for. And then following that will be the head, ears, eyes, nose, throat, and neck exam on the client. So I'll start off checking the client's head, checking for any parasites, bumps, lesions, or that. And then I'll inspect the client's face. So I'll be checking cranial nerve 5, which is the trigeminal, along with cranial nerve 7 for movement. And then after that, I'll inspect the client's eyes, looking for any discharge, redness. I'll inspect the size and perla. That's cranial nerve 3, the oculomotor nerve. And then following that, I'll then, after the eyes, I'll inspect the extrameter muscle movement. So that's cranial nerve 3, 4, and 6. And then I'll perform the coordination, the confrontation test, which would be testing cranial nerve 2, the optic nerve. And then after that, after the confrontation test, I'll move to the client's mouth. So I will be checking the mucous membranes on the client for general dentation on the tongue. I'll see if it's midline. I'll ask the client to say ah. Checking the uvula midline, I'll observe the swallow, which is cranial 9, the glotophageal nerve, and cranial nerve 10, which is the vagus, and cranial nerve 12, hypoglossal. And then I'll inspect the client's nose for any discharge, redness, nasal patency. I'll make sure it's in shape. I'll make sure there's no deviations noted. And then I'll inspect the client's ears for serum or other discharge in the external ear. And I'll be looking for any lesions. I'll perform the rubbing finger test on cranial nerve 8. That's acoustic. And then following that, I'll assess cranial nerve 11, having the client perform shoulder shrug. And then I'll test their head with resistance. And then once that's over, I will palpate the lymph nodes, so it's the lymph nodes is submandibular, submantle, tonsillar, postauricular, preauricular, anterior cervical, posterior cervical, occipital, and then supraclavicle. And then next, after I palpate the lymph nodes, I'll move on to assess the lungs, thorax, and back. This is a lot on the client. So I'll inspect the shape of the thorax. I'll make sure it's in comparison with the anterior, posterior, transverse diameters. And then after that, I'll assess the client's respiratory rate. I'll make sure it's in depth and rhythm. And I will see if the person has a cough. I'll inspect the spinal alignment. And then after that, I'll percuss for costovertebral angle tenderness. I'll palpate the thorax. I'll palpate the tactile fremitus, and then I'll auscultate the breath sounds on the client, anterior and posterior. That's in 8 places on each side, and 2 places in the axillary region. And by that, I'll obviously have to use my stethoscope. And then will be the heart and central vessels assessment on the client. So I'll auscultate the carotid artery for Brught's on the client, and then I'll auscultate the heart sounds in the pulmonic, Erb's point, tricsipoid, aortic, and there's one more that I'm missing. Starts with an M. I know it starts with an M. I don't know it. I forgot. But I'll be listening to those sounds using my stethoscope. And then will be the gastrointestinal and genitourinary assessment. So I'll inspect the client's shape of the abdomen. And then I'll auscultate the bowel sounds in all 4 quadrants on the client. And then I'll be obviously using my stethoscope. Then I'll lightly palpate all 4 abdominal quadrants for distension or tenderness. And then finishing that part, I'll assess the bowel and ask them if they have any urinary problems. And then after that will be the musculoskeletal, neurologic, and the vascular assessment. So I'm going to inspect and palpate the client's extremities for tenderness, edema, temperature, any lesions, any deformities. And then I'll check the client's fingers and toes. And then I'll inspect for gait and balance on the client. So I'll use the Roomberg test for that. And then I'll assess range of motion on the neck, legs, and arms. I'll assess the strength in all extremities. And then after that, I'll perform the deep tendon reflexes. So that's triceps, plantar, biceps, plantar, Achilles, and something with the B. And then following that, I'm going to locate and palpate the brachial, popliteal, posterior tibial, pedis. I'll assess the symmetry and strength for that. And then that will be the full head to toe exam. Obviously, it'll be longer. I'm just speaking it. So when I'm done performing the test on the patient, I will ask the patient if they feel comfortable. I'll ask if they have any questions. I will give them back their call light, make sure they have their personal belongings, and then I'll wash my hands and take my gloves off, and then that's it. The test is over. Okay, thanks.